you
Yeah.
are like listening to him also,
Yeah.
like your face can be more natural. Cause I realized like it's very stiff, like you're smiling.
Like too much Botox, right? Hi everybody, today we have Dr. Heng from the Ogee Clinic joining us for SBO Chats. Hi Dr. Heng.
Hello, hi Vin.
Dr. Heng, we would like to explore with you what's your entrepreneur journey, how has it been, and also at the same time we want to talk about like the aesthetic industry as well, just to explore the industry, what's late, what's new, what's coming up. Okay, so why don't you share with us a little bit more about like your professional journey, like when you were in a hospital or when you were an employee at a clinic?
Okay. So I'm an aesthetics doctor, and I've been practicing as a doctor for almost 10 years. I first started out as a hospital doctor. After a few years, I left. I go to the private sector as a private doctor, and I started out my aesthetics journey in a group practice with a group of doctors, practicing solely aesthetics. So lasers, Botox, fillers, and generally we do facial reshaping, facial contouring, and facial relifting without going through plastic surgery.
Okay, so that means no knife at all.
We stop short of cutting the skin. So we stop short of leaving scars on the skin. So that is what we aim to do.
Okay, right. So how was your experience like when you were working at a clinic? Hospital or clinic?
It was a clinic.
Clinic,
it was a
private clinic, yeah.
Group practice, a few doctors headed by a very senior doctor. So most of us function as a practitioners.
Okay.
So seeing the patient, because actually aesthetics medicine is not really recognized as a specialty in Singapore. So most of the time we just practice in the clinic, in the private setting, and we see patients in a private setting.
Right. Yeah. So now that you have your own private clinic, right? What happened that made you think that I'm going to have my own private practice?
Actually, the misconception for most people is that when you set up a private clinic, it's like a very major decision, a very major big idea. For me, it's more a personal journey which I want to take. It's a sort of a challenge to myself. Truth be told, most people cannot believe that I actually decided to take the journey to go out of the private of the group practice to come out on my own.
Why so?
because at the time, I must tell you that the group practice, the clinic was very well run.
Okay.
And as doctors, as medical practitioners, most of us don't want to think about things that actually distract us from our main business. Our main business is actually treating patients to the best of our abilities.
That is true.
Yeah. So when we're inside, we just try to do the best for the patient, and that's it. It's not really a 9 to 5 job. It's retail hours, so it's like 11 a.m. in the morning and then all the way to 7 or 8 in the evening. Quite similar to now, but it's just that when you come out on your own, you have to think of many other things. You got to think of not just the patient, but also how the patient feel. The moment she stepped into the clinic, or the moment he or she walked through the corridor of your clinic, and
the
whole
experience.
ambiance, yes, and the experience. So the patient journey experience is not just confined within the consultation room. When I first come out, it is more of it's more like an impulse.
Yeah.
I just felt that right now I'm still young. I can do this. So I better do this now. I mean, I can wait maybe 5-10 years later and I do it, but I'm just afraid that I may not have that kind of energy already. Like 40 years old versus 30 years old, I think the energy level is different.
Yeah.
The kind of commitments that I may have now in future may be quite different from right now also.
Yeah.
So I just felt that now I think now better than never.
Okay.
Yeah.
Okay. When you start your own practice, what were the realities that hit you?
The reality is that actually the doctor's job in the clinic is just one part of the whole I would say the clinical experience of the patient. Yeah. So all the way since from the time the patient hear about the clinic or hear about the doctor to trying to look for the clinic or the doctor on the website, or
SEO website,
from their friends or from other patients. So all this has to be taken into account.
Wow.
Yeah, so it is for me it is a learning journey, you know. But I realized that to be able, when you're on your own, to be able to do the things that you want to do, you have to do the things that you actually may not like doing first, to build a foundation, so that so that finally when the patient come into your consultation room, you can treat her to the best of your ability.
Yeah. Okay. Let's talk about a little bit about the things that you don't like to do when running a business. So, what are some of the things that you don't like, but you had to do?
Yeah. Okay. So I would say that actually most doctors, when we during our course of training, we are trained to be medical practitioners.
Yeah.
We are trained to be able to be to service patients in a medical way, and things like it's not even business. It's like operations, like business operations. You know. So all these never really come to mind. How
like social media.
Social media, that's the marketing aspect.
Right,
but
right.
inside the clinic itself, like the finance,
okay.
the servicing of like normal bills, electricity,
Yeah.
to be paid, and then staff, HR. So all these are a learning experience for me also.
Yeah.
So besides still keeping up to date with the medical aspects, in terms of technology, in terms of knowledge, I still have to quickly get up to speed on the business side of things.
Okay.
I mean, of course, I have other people helping me. So I mean, I thank them a lot.
Okay. So generally, what do you think? How do you think your life has changed the moment you decided that you are going to run your own practice? Or has it not changed?
I think, okay, because for me, I speak from a point of view of a practitioner. I think most professionals, be it doctors, lawyers, engineers, maybe accountants, you know, or auditors, they are considered professionals. They are considered practitioners in a field, rather expert. You know, if they want to go full time into this, when they finally decide to take a step, the next step, they say, okay, I don't want to be employed anymore. I want to set up a business. Usually, the day itself is the most exciting when they make that decision.
Yeah.
The next day usually is their worst day. Yeah, because very soon, at least it's for me. Very soon you realize that actually you are alone. You know, so it's not just you yourself alone, but your loved ones may not see the kind of the reasoning why you want to choose this path. Yeah, so it takes a bit of convincing. Takes a while to convince them. But definitely, you have to stay true to what you believe in.
Yeah.
And then time will work its magic.
Okay.
And then after a while, what I see is that my family, my friends, you know, they at least see what I'm trying to do.
Yeah. So how did your family react the moment you shared with them that I'm gonna do my own clinic?
Rather in shock and disbelief.
Okay.
Yeah, because I don't come from a family of like entrepreneurs
Okay.
or business people. Usually the career advice that my parents will give me is study hard, try to study hard, get out of trouble, stay out of trouble, and then try to get a good job, and then you know, just work.
Asian parents.
Asian parents, yeah. So far when I decided to run a business, I actually deviated from this, except working hard.
But now you have to work doubly hard, right?
Yeah, maybe triply or quadruply. Yeah.
Let me ask you a little bit more about like the aesthetic industry lah.
Okay.
The aesthetic practice is all about looking good. You know, do you think that it's a very superficial industry?
I think you can say yes and no, depending on where you come from and what your motivations are.
Yeah.
There are some patients who just, you know, want to look good, but there are many other patients who want to look confident and want to feel confident. So when I treat patients, I stand by the principle of everybody has the right to look beautiful, and everybody is also beautiful in their own right. Yeah. So depending on where the patient is coming from, some of our patients, when they come to see me, they have never done anything before.
Okay.
You know, and they just want to look, you know, more refreshed.
Yeah.
They feel that they look more tired, you know, and they just want to look like their age.
Right.
You know? So that is one group, and of course at the other extreme, we have some patients who are very up to speed and very up to date with their injections and also their skin treatments. Most importantly, for aesthetics doctor, when we see patient is to advise them what is the best for them at that point in time, you know, and never to go overboard, because aesthetics is also about looking natural.
Okay.
Yeah, it is doing art on the face,
Yeah.
to a large extent,
Yeah.
but in terms of art, we tend not to go for abstract art. We want to go for more Renaissance style art and more real. Yeah.
Okay.
And something that your neighbors can relate to, your friends can relate to,
Okay.
and you yourself can relate to. So
Okay.
we try not to change how he or she looks like, but we just want to make he or she look better.
Okay. So when you mentioned abstract art, I just thought about Donatella Versace. You know
Yes.
about her, right? So what do you think about?
I think
Would you like to comment?
okay. Botox has been done in the US for almost 30 years. You know, so when it is first discovered, it is a very powerful drug. It's a very powerful ingredient, and it gives rise to the aesthetics industry generally worldwide. You know, so but at the time, most doctors, they are still trying to figure out how does this work,
Okay.
and what is its limitation,
Okay.
and how far can it go.
Okay.
You know, so I think those were the periods. I think the 90s, even the early 2000s, is a period of discovery, exploration. So definitely there are cases of like overdone faces,
Okay.
frozen look,
Okay.
and most of the patients at the time when they're asking for it, they are people and personalities with disposable income.
Right.
So they want to do it, they want to pay for it, and the doctors are happy to give it because they can give the results to the patient. Of course, fast forward down 20 years later, we know more about the facial structure, we know more about the skin, and we know how these products behave in certain areas where we put, and therefore we can opt for more natural results. We know when to say stop.
Okay.
And if for us practitioners, when we know when to say stop, we should tell the patient that this is your best look, okay, and you should be happy with it.
Okay. Do you think that there's a uptrend in terms of people's awareness about aesthetics?
Oh yeah, definitely.
Or,
Yeah, I mean,
or is there a higher demand for it?
higher demand also because of increasing awareness and thanks to the internet, thanks to social media,
Yeah.
Instagram, YouTube, we have people sharing,
Yeah.
not just celebrities,
Yeah.
I think not just bloggers or influencers, even normal people, you know, your neighbors, your friends, you know, when they've done the treatment, they're happy with the results, they maybe even wow with the result, they're happy to share it, you know, and this is not incentivized kind of sharing. They share it because they are happy to, and when that happens, the word gets around, and people realize that, oh, there are actually such technologies available. So definitely, rise in aesthetics treatments, rise in injections, lasers, more than plastic surgery even, I feel.
Generally, what are the kind of clients that you see? Like, you see more Thais or, you know, models,
Yeah, definitely.
celebrities.
Okay, so definitely more females than males. In this clinic, we see about 80% of our patients are females,
Yeah.
20% males. Although the males are also increasing in number. That's for gender. Age group wise, I see a variety, because I see quite a lot of patients with acne scars. So younger age group, they tend to consult because of that. Slightly older age group, they want to do fillers, Botox, just to keep up and just to make their face as refreshed as possible.
Speaking of male patients, right? I'm actually one of Dr. Heng's patients as well. Generally, when you see male patients, right, what are the kind of treatments that they seek?
I think early 30s and below,
Yeah.
they tend to seek treatment for acne scars.
Okay.
Some of them may still be suffering from effects of acne, severe acne, and these are the few more common skin problems which I see. In terms of facial contouring, because most of them want this, like this Brad Pitt look, nice jawline,
Is
very
it
solid masculine jawbone.
Okay.
Yeah. Okay,
angular lah?
Yes, more
Right,
angular.
okay.
And so yeah, they some of them seek filler treatments
Okay.
for facial resculpting.
Also, fillers you can do. You can actually make it sharper.
Yes, yeah. We can
cool.
we can actually make the facial contour sharper,
Okay.
more defined, or perhaps even more rounded, more lifted,
Okay.
depending on the indications.
Right.
We can actually tailor the filler treatment as such for the
Okay.
patient.
Right.
So it is quite versatile.
Okay.
Yeah.
So for the older age group,
For the older age group, usually lifting,
lifting.
wrinkle reduction.
Okay.
Yeah.
Right.
Yeah. Although that being said, there's a trend of younger patients seeking wrinkle reduction treatments, Botox treatments, because the thinking has changed.
Yeah.
You know, so previously when we see a wrinkle, we want to inject Botox to reduce the wrinkle.
Yeah.
Now we actually know where the wrinkles are going to happen.
Okay.
Okay, and when we first start seeing some signs of it, we go in at a much lower dose,
Okay.
and try to prevent the wrinkles from setting in too early.
Wow.
So instead of a therapeutic,
Yeah.
Botox, it becomes more like a preventative.
My
Botox.
Minority Report. On the
That's quite that's sensationalizing it, but,
Yeah,
but
okay.
that's the rough idea.
Okay. You know how like Singapore is a good place for tourists to come in for medical tourism, right? So do you see patients coming in overseas, to seek treatment?
Yes, definitely. From regional, definitely. Australia,
Okay.
Down Under, Indonesians, yes. Some Vietnamese, definitely quite a few from mainland China. Yeah. But that being said, I mean, with regards to your previous statement about Singapore being a medical hub for medical tourism, and medical tourists coming in, I think the competition is actually quite stiff right now.
Okay.
Yeah, from the neighboring countries.
Yeah.
The numbers are still coming in.
Yeah.
Yeah, but the numbers has started to decline.
Oh.
Number one, and what we see is that those at the middle, at the upper middle income group, tend to stay within their own countries to seek these treatments, because now aesthetic medicine has penetrated almost all countries.
Right.
Yeah, so definitely those people who can afford it, they will still travel. Yeah, but those patients who are not so price sensitive, they may choose to do such treatments in their own country. Yeah, so actually the challenge for Singapore is that we got to go higher end.
Okay.
We got to go more high end. I think we got to go more in terms of branding, establishing ourselves as the leader within this region. Yeah, and then not to go cost or price competition with the rest of the countries.
Yeah, that's true. Okay. You may have seen your fair share of foreign patients, right?
Yeah.
So, do you think that in general, right, their aesthetic sense is the same or slightly different? Like, like maybe certain countries they like a more,
Yes. Yes, I understand what you mean. But when I get in trouble by saying this, it's going to
Okay,
be
you don't have to name countries, but like maybe you can like just share with us.
okay,
like
I will just say how Singapore differs from other other countries. I think
Yeah.
I think Singaporeans as a whole within Southeast Asia itself, we in terms of the aesthetic sense, we are more understated.
Okay.
Yeah. So yes, we want to do things. We know how most of our patients they are very very knowledgeable. They are kept very up to date because of internet, Google, social media. So when it comes to selecting the treatments and selecting the results that they want, they tend to go for really natural results, which is good, and they don't want to go overboard. Yeah. So they want the effect where
people can't see.
Yeah, your neighbors will say, "Oh,
the-
you look very good, you look very fresh,"
Yeah.
but they cannot really pinpoint what exactly has been done for
okay.
you. Some other countries' patients, when they come, they want a rather pronounced effect.
Okay.
They want it more obvious.
Yeah.
And sometimes I understand because they come all the way, they fly here, say, "Doctor, I fly in, I want to see the result." So
Right. Okay.
I can understand as well.
Right. Okay.
Yeah, so I think depending on the culture,
Yeah.
depending on I would say societal pressure, or what would I say is social norms within a country itself,
Yeah.
or within the patient's existing social circle.
Yeah.
So it will definitely determine what their perspectives on aesthetic treatment results are.
Right. Okay. So you mentioned that consumers these days, aesthetic patients these days, right? They are more like well informed. There's the internet.
Yeah.
So, but I'm pretty sure there's like the downside of it. Like maybe they they think that, oh, I Google already, then actually you are doing it wrong. They start to tell you that you are wrong. Why don't you do another procedure for me? Did you get that?
Yeah. Actually, this problem is not just within aesthetics itself. In fact, I think within the aesthetics medicine industry, it's quite a small issue.
Yeah.
I think basically this is a Google phenomenon.
Yeah.
So because of Google itself, most patients, they become like
self-diagnosing.
yeah.
Look at these wrinkles, I have cancer.
Yeah. so most of when it comes to aesthetic medicine, they can actually question us, they can ask us things, and we actually welcome that, because that actually we can engage them in a more lively discussion, and we can keep them more actively involved in their own treatment. When it comes to something more serious like life and death, so like what you say, cancer, or perhaps some more debilitating, more serious kind of medical condition, then I feel that some of my specialist counterparts in the hospital may have a tougher time to be able to explain to them, because it is not just medicine. It's not just Western medicine. Sometimes they hear that, oh, if I just eat fruits and drink water, and not eat fish and meat, and then I'll be cured of cancer. So that kind of that's an extreme way of thinking, and sometimes it can be supported with anything that you search online, if you search hard enough. Yeah, I think that is a challenge. So aesthetics wise, I think as long as we can give the results, they will be happy. Yeah, and we can always. We tend to go a bit more conservative first, especially for first time patients. The idea is always that we can add more if we need, but if you want to subtract the kind of result, if you are not happy with it, then it may take some time.
What do you think is the future of aesthetic industry in Singapore?
In Singapore itself, I think it's going to be even more prevalent, even more competitive, definitely, because the number of clinics coming up is not decreasing. But it's also a good thing, because like I said, awareness, there's increase in awareness throughout the population. So I think it's a good thing, and I think very soon aesthetics medicine will become commonplace. Most people will treat it as part of wellness. So part of wellness lifestyle, part of feeling good, and part of health and fitness even.
Having run this business for about a year, what advice would you give to professionals thinking of starting their own practice, regardless of whether they are aesthetic doctors? They could be other doctors, it could be lawyers, accountants, and so on.
I would say that you can never be too ready, and the moment you decide to jump onto this path, you'll be quite lonely at first, but I think don't give up, because most of us, when we jump into entrepreneurship, it's because we haven't thought of everything very clearly. But if we have thought everything very clearly, most of us would not have jumped into this in the first place. And then lastly, you have to have the passion for it, because it's only the passion for entrepreneurship, doing what you love to do, trying to perfect your craft, that will bring you the distance in this journey.
All right, Dr. Heng, thank you so much for joining us today.
Thanks, Lin. Thank you.
That was Dr. Heng from the Ogee Clinic. If you'd like to see more, like our Facebook page and subscribe to our YouTube channel. We'll see you in the next one. Do I have that face? Because the previous video I had a face. It was a very horrible face. Yeah, that my default face looked very like. Okay, see you in the next one.
No.
Yeah. So when you're editing, you must. Please subscribe to our YouTube channel with the link in the caption somewhere. Like our Facebook page and follow us on YouTube.
Like our Facebook page and subscribe.
Subscribe. Subscribe.